Hello, everyone. So, for today, we're going to be talking about pandemics throughout the history. So, first things first, as we have moved amidst the coronavirus disease that has happened in the year 2019, we have witnessed tremendous distress, death, and turmoil every day in our lives for more than a year. Deadly pandemics have happened throughout the recorded history. So it wasn't Corona that started it all off, but we had the plague, we had Spanish flu, HIV, and Ebola. Of course, all of these different types of pandemics has resulted into deaths, destruction of political regimes, as well as financial and psychological burdens and psychosocial burdens as well. However, sometimes it resulted into scientific discoveries and it also resulted into understanding the mechanism of the emergence of these pandemics, which is crucial in order to control any spreading that happened in any type of pandemics and to prevent the emergence of a potential new one. Now, what is a pandemic? In the year 1666, the term pandemic was first used in order to describe a continuously spreading disease over the country. Now, the word epidemic and pandemic has been used interchangeably over the year of 17th and the 18th century in many social and medical contexts. But of course, we need to know the difference between those four words that we see them a lot. So the first one is endemic. Endemic means it is a disease that affects a population in the same area, for example, in a town, in a country, or a continent. An outbreak is an unanticipated increase in the number of people who present with a health problem or the emergence of cases in a new location. Epidemic is when you take that and you spread it over a larger geographical area. And then we have the pandemic, it's when it is more than one continent. Now, why do pandemic occurs? Now, the first reason that could result into the occurrence of a pandemic would be the climate changes, because the climate change holds a very significant impact in the transmission of specifically the zoonotic infections by influencing the environment of their vectors. Then we have the increased land use because of the expanding human population. Then we have the increased animal to human contact that happened or that has developed over the years. Antimicrobial resistance is definitely one of the leading causes that causes an increase in the potential of a future pandemic. The potential use of microorganisms as biological weapons. And last but not least, we have healthcare workers shortage and underprepared health. Now, we are all quite aware of what could be the negatives that can happen of a pandemic. Now, that could be definitely causing overwhelming in the healthcare system, which we've all noticed during the 2019 COVID pandemic. And this causes or leads to the limited access to health services and increased mortality rates for both communicable and non-communicable diseases. Not only that, but there is also a significant effect on the social, economic, and political aspects. Now, we're going to talk about this shortly in details. Now, what about the positive of pandemics? Now, there's definitely a silver lining to any sort of pandemic that occurs over a history of time. Now, recent pandemics managed to increase pandemic preparedness and led to efforts to mitigate the effect of pandemics. Then we have developed labor saving and efficient technologies to compensate for the labor loss. Now, this table just contains the list of some of the pandemics that occurred throughout the history, starting from the Athenian plague that occurred 430 to 426 BC. And we have to the latest one, which is the COVID-19 that we've all been through, that happened from 2019, and it is still ongoing. Now, it has been said that the deadliest pandemic that occurred over the history of time was the Black Death. Now, the Black Death occurred over the year of 1347 to the year of 1341, and it has resulted into the extinction or the death of 50% of Europe's population. Now, moving on to the impacts of pandemics. Now, we're going to cover the different criterias or the different aspects in which a pandemic can affect. The first thing would be the economic impact. A pandemic disproportionately affects the younger group of people who are considered to be as the active contributors to the economy. So definitely when those population or when that specific category is affected, it's going to cause a very big increase in the damage in the economy since they are the main contributors. Second thing would be is, of course, it reduces the interaction with the suppliers, reducing the demands for goods and hence services that require close contact with. The last thing would be non-pharmaceutical interventions, such as nationwide lockdowns. Though necessary, of course, to prevent the spread of a pandemic, it definitely affects the livelihoods of millions of people globally. Now, the societal impacts, which we've all been through or we've all seen, is it had caused an increase in the work from home culture, which incidentally accelerates the use of technology and increased productivity from the comforts of home, which is technically what I am doing right now, which is basically doing a presentation using technology, which is something that we haven't really done or most of the time back in time it was mainly done face to face, but because of that it did result into the increased use of the technology from the comforts of home. Now the full impact of COVID on the primary and secondary education has not been yet fully revealed. Last thing we have is you need consortium of scientists, healthcare workers, industries, government policymakers. All of this is required for us to manage the pandemic. And of course, it cannot be solely managed at a national level. The mental health and the public response impacts. Now, the mental health, it had led to the contagion of greed, corruption, and avarice, which paradoxically increased infection and led to mortality. Shortage of food essentials, maybe not so much in the country that we're living in, but of course, in developing countries, that's definitely being seen over there. If we're talking about the public response, discovery of antibiotics, which occurred in the 1940s, consequently, it resulted into the development of numerous vaccines and improvements in disease surveillance strategies. Public disbelief of disease presence. Now we're going to talk about the negative or the other side of a public response, which is disbelief of the disease presence. We have a lot of people till now who don't believe that COVID-19 exists. Disregard of government rules. A lot of people still don't 100% follow whatever rules that have been set by the governments in regards to the spread of a pandemic. Propagation of myths and the misinformation, which we've seen a lot during COVID-19 through the WhatsApp, through Facebook, and other social media. A lot of misinformation has occurred in terms of that. Unclear communication, and of course, inadequate personal risk assessment. Then we have, it was found that the younger population, people of comorbidities and symptomatic patients were affected more in terms of their psychological well-being. Now we're going to move on to talking about different types of dilemmas. Now, the first things we have is caregivers, they struggle with overcoming the balance between individual ethics and utilitarian ethics while making decisions. So, for example, if we're talking about the healthcare workers, they had a difficult choice in terms of making imperfect but necessary decisions, which led to the disturbance of a patient's themselves or the patient's skins, and of course, their own mental well-being. Societal ethics govern decision making rather than individual ethics. Now, what do we mean by this? We mean that it is not only related to the individual. Right now, we're talking about public. Now, we're talking about a bigger scale of a population. So now the pandemics, they caused a shift in the operative framework of clinicians from something considered as standard to something of a public health. Now, all of these institutional obligations, they broaden from patients to now cover clinicians serving the patients. Due to the absence of appropriate framework for clinicians to navigate through moral dilemmas, of course, we've seen it a lot in our hospitals where there's a lot of moral dilemmas that occurred. It resulted into confusion or harm in the lasting career implications. Coming right down to summing all these points up, which is the conclusion. Now, the pandemics have caused millions of deaths and had impact on the economy, on the society, and of course, the mental well-being of not only the people, the healthcare workers, and the entire human population. Scientific breakthrough is in terms of discovering the concept of quarantine, the development of vaccines, and the novel treatment modalities. So, of course, everything in life has a silver lining. So, there's, of course, definitely the negative impact, which we all know about. But of course, we also have the good things that arise from it, which is the things that we've just discussed right now. Now, there is an unmet need, of course, to increase the awareness and exercise of pandemic preparedness in order for us to avoid all of the burden that our healthcare system have witnessed. And of course, the most important thing, to avoid the loss of our loved ones. And of course, because of that, we need future research that has to focus on developing better ways to prevent the emergence of these diseases and to perform a uniform response. Unfortunately, the COVID-19 pandemic has proved that we are not yet prepared to detect, predict, or control the spread of novel pathogen pandemics. Thank you very much.